Yes, Dr. Abhijit. First of all, introduce yourself.
Sir, myself, Dr. Abhijit Kaushal. I belong to Patna, which is one of the oldest city of India. I did my MBBS from Anugrah Narayan Magad Medical College, Gaya, and I also have a very salubrious experience in government medical hospital for approximately 1.5 years. I also have attended workshop on pneumonia in neonates. My friends call me versatile because of my adjustable nature.
Okay, enough. Now I want, what is your favorite topic? Like surgery, medicine, gynae. What is your topic? Pedia, ENT?
My major interest is in medicine, sir.
So tell me first of all about arthritis.
Arthritis is basically a joint inflammation, joint surface inflammation of cartilage, in which basically patients complain of pain and swelling. The pathophysiology of arthritis is due to the increased level of uric acid in blood, which get inside the joint capsule, and the alveolar cells, which eat the uric acid. In response, the uric acid engulfed by the neutrophils, they release cytokines, which further recruits the more and more neutrophils, which leads to inflammation of the joint surface, and patient feels the pain and the swelling occurs. For the treatment point of view, we used to halt the inflammation. Basically, we use steroids, disease DMARDs, disease drugs required for DMARDs drug like allopurinol, febuxostat, rasburicase, etc. Sir.
Okay, tell me about acute respiratory distress syndrome.
Acute respiratory distress syndrome is basically seen in neonates, which are preterm or premature babies. It is due to due to that lungs are immature. The surfactant is not formed ample, so that alveoli do not get inflated, and the babies is not able to respire. For this, we have to give steroids, intratracheal steroids to the babies, or we can give steroids to the mother beforehand, before delivery, for the lung maturity.
Okay. Tell about COPD.
COPD is basically a chronic obstructive pulmonary disease in patients, which includes bronchitis, chronic emphysema, and chronic bronchitis. In patient suffer if patient have decreased lung capacity, and the ratio of FeV1 upon FVC is also get reduced. In this patient, we have to give bronchodilator beta 2 agonist, steroids, and mast cell stabilizers, etc. Sir. Yeah.
Okay, can you name other heart sounds?
Yes, sir. There are various heart sounds like S1, S2, S3, and S4. And apart from these sounds, there are ejection click and opening snaps. S1 is basically due to the closure of mitral and tricuspid valve. S2 is basically due to closing of aortic and pulmonary valve. S3 and S4 basically are pathological heart sound, which is not heard normally. S3 may be normal in pregnancies.
Okay, tell about heart failure.
Heart failure is basically heart stopped its function. It can be due to conduction blockage, or it can be due to muscular fatigue.
Okay. Okay, tell about meningitis.
Meningitis is basically the inflammation of the meningeal layer of the brain and spinal cord. There are two types of meningitis, that is leptomeningitis and pachymeningitis. In meningitis, the CSF, there are various changes in the CSF. Leptomeningitis, which involves dura and arachnoid, and pachymeningitis involves all the layers of meninges. There are many reasons that causes meningitis, like viral meningitis, bacterial meningitis, tubercular meningitis, fungal meningitis, and due to septicemia. And in every meningitis, there are some cytopathological and biochemical changes in the CSF. Like in viral meningitis, there is increase in protein count, and sugar remains normal, and chloride levels can be raised. In bacterial meningitis, sugar level will be low, protein will be high, and chloride will also be high. In tubercular meningitis, there is peculiar abundance of polymorphonuclear cells and lymphocytes, and there is a rise in protein. There will be low decrease in glucose, and there is also a pathognomonic feature is cobweb coagulum in tubercular meningitis.
Okay, tell about encephalitis.
Encephalitis is basically the inflammation of the brain parenchyma. It can be due to some biochemical changes in blood, like urea, ammonia, or it can be due to toxin produced by bacterial or any other organism, or there are some metabolic changes in the blood which causes encephalitis, like hepatic encephalitis, etc. So,
Tell about acute coronary syndrome.
acute coronary syndrome is basically when there is any demand, there is basically, it occurs due to imbalance in demand and supply of the oxygen in the heart. If anywhere ischemia occurs, it is itself a very potent stimulator of vasodilation. But in acute coronary syndrome, there is already a plaque there exists already a plaque in the blood vessel of the heart, which allow blood vessel to dilate, but as compared to the normal vessel, the plaqued vessel do not get dilated more, which leads to reverse Robin Hood phenomena. It means that blood flows in the normal caliber vessels more rather than plaqued vessels. Therefore, acute coronary syndrome occurs.
I am asking, whatever question
Yes,
I have asked, have I given you in medical portion what I give just now? No, it was not given. These are new questions.
Oh.
So there are abundant of questions, right? It's an ocean of questions we have. You should prepare all.
Yes.
How are you feeling with PD classes? कैसा लग रहा है?
I'm feeling very fine, sir.
Okay.
I feel more confident.
Okay.
Now.
It is our duty also, yeah, to make you confident. Tell about asthma management.
Asthma management, there are two ways we can manage asthma. If a patient presents with asthmatic attack, or he have chronic asthma. If patient presents with acute asthmatic attack, we have to proceed different way. Both the situation, we have to proceed with the bronchodilators, beta-2 agonist. We have to give steroids, either orally, either in puff or IV. We have to give oxygen supply, moist oxygen supply, and then we have to give some antibiotic to prevent the basically hospital acquired infections. In chronic condition, if patient presents with chronic asthma, we have to first rule out the degree of bronchoconstriction in the patient, or we have to check the lung compliance. After that, we proceed with a short, depending on the patient, we give a short-term bronchodilator, long-term bronchodilator with prednisolone or other steroids, and some mast cell stabilizer, montelukast or jafirlukast. Or in worst case, we have to give monoclonal antibodies.
Wonderful. Now tell about cirrhosis.
Cirrhosis is basically inflammation and fibrosis of the liver. It occurs either in alcoholics or non-alcoholics, or it can also occur in after viral infections or bacterial infections, in which the liver get inflamed, and after that, in due course of time, the liver get fibrosed. The hepatic architectures get distorted in cirrhosis.
Okay, my next question is diabetes insipidus.
Diabetes insipidus is a type of diabetes. It can be the patient diabetes insipidus. It can be of two types: either central diabetes insipidus or nephrogenic diabetes insipidus. It is basically due to the either ADH, decreased level of ADH, or the receptor responding to ADH get defected. In central diabetes insipidus, there is decrease or no levels of ADH. And in nephrogenic diabetes insipidus, there is ADH is abundance in the blood, but the receptors responding to the ADH is hampered, basically, leading to the increased osmolarity of blood and decreased osmolarity of the urine and polyuria and polyphagia.
Okay, tell me about portal hypertension.
Portal hypertension. Sir, I will recall, sir. I cannot recall.
Okay. Now my next question is cardiac tamponade.
Cardiac tamponade is basically due to either trauma or a sudden rupture of any superficial blood vessels of the heart, leading to accumulation of fluid in significant amount, causing heart to perform its function. Performance of the heart get decreased. There are three main features of cardiac tamponade, that is raised JVP, muffled heart sound, and decreased systolic heart blood pressure. That is also known as Beck's triad.
Okay, tell me about ascites. Ascites.
Ascites, there is accumulation. Ascites is basically the accumulation of fluid in peritoneal cavity. It can be due to many reasons, like liver or kidney involvement, or it can be due to cardiac congestive heart failure. It can be due to portal hypertension, cirrhosis. Basically, the oncotic pressure of the blood get decreased and fluids seeps out of the vessels and get collected in the peritoneal cavity. And depending upon the fluid, there are two types of fluid. That it can be either transudative fluid or exudative fluid. And we divide this transudative exudative on the basis of protein content in the fluid.
Very good, doctor. Excellent. Tell about acute kidney injury.
Acute kidney injury. Sir, acute kidney injury occurs either due to toxins or any drugs or any poisoning conditions, or in cancer category patients, when we give patients chemotherapy, there is a chances of occurrence of acute kidney injury. There is inflammation of the renal parenchyma, renal tubules, leading to failure of the functionality of the kidney. Mic is off, sir. Your mic is off, sir.
Vasculitis.
Vasculitis is basically the inflammation of small and medium-sized blood vessels.
Vital blood supply. Cutting off vital blood supply to tissue and organs.
Yes, sir.
So, would you like to tell something about can cause vessel walls to thicken and narrow, cutting off vital blood cells to tissues and organs?
Vasculitis is basically inflammation of the tunica media of the small and medium-sized blood vessels supplying to the particular areas. Okay. Which further vasculitis can be fibrinoid or calcified or lipoic. There are different types of vasculitis that occurs in the blood vessels.
Okay.
Fibrinoid, there is saponification of the cholesterol with calcium, or there is calcific vasculitis, that is deposition of the calcium in blood vessels, tunica media, which leading to hardening of the blood vessels. Sorry.
Okay, you already stated very well. Do you know about AED?
AED, sorry sir, would you like to tell me the full form, sir?
Yeah, I'll tell. Sure, yeah. Automated external defibrillation used to give DC shocks.
Sorry, sir.
Right?
Yes, sir.
Okay.
I don't recall, sir.
Wonderful, yeah. You have answered very well. I appreciate. Can you tell me about ACLS?
Yes, sir. Advanced cardiac life support. This is basically it is used in basically trauma management in patients. The WHO gives the guidelines to manage the trauma patients.